A new study suggests that after a concussion, there are more kids that have POTS and other kinds of dysautonomia than we originally thought. That was published today in JAMA. The study is called Prevalence of Orthostatic Autonomic Dysregulation in Pediatric Concussion, so we'll break that down today. So the study looked at the medical records of kids attending a specialty concussion center in Canada. They did something called orthostatic vital signs testing, which is a test that we often do in our office. So basically, they're looking at the pulse and blood pressure of a patient when they're laying down, when they're sitting, and when they're standing upright. And they wanted to see if they fit the criteria for POTS or orthostatic hypotension. For kids, you're determined to have POTS if you go from laying down to standing and your heart rate goes over 40 beats per minute and is sustained at that level. For orthostatic hypotension, if you go from laying to standing and your blood pressure, the top number, systolic number, goes down 20 points or the bottom number goes down 10 points, then they're considered to have orthostatic hypotension. So they took all these patients and they compared them to healthy controls that didn't have a concussion. When they looked at the data, about 10% of those kids with a concussion showed signs of orthostatic hypotension or POTS, and almost 25% of patients actually felt some type of symptom when they went through that testing. The authors spent some time discussing the discrepancy between those that actually met the criteria for autonomic dysfunction and those that just felt the symptoms of it, and I have some thoughts on that. First and foremost, the authors noted that if you actually apply the adult criteria for POTS instead of the kids' criteria to POTS, then all of a sudden 23.73% of the cohort actually showed autonomic dysfunction. And that's important because these numbers are kind of arbitrary. So if we're leaving out patients that show a 35 or 39 beat per minute increase in heart rate and just say, nope, you don't have POTS, then I think you're leaving a lot of people that have some level of autonomic dysfunction out to dry. Second is the idea that they use orthostatic vital signs when the gold standard for diagnosing POTS is the tilt table test or an active stand test. The authors dismissed this little criticism because they said that if they use the tilt table test or active stand test, while that increases sensitivity, it might harm their specificity. But the most important thing for us to find out is, does the patient actually have autonomic dysfunction? And these are the tests that's actually going to help the patient hit those criteria. So while I do think this is a good addition to the literature showing that 10% of concussed kids do show autonomic dysfunction, I do think that if we actually did a proper study, then the actual true number would probably be closer to this 23.15% number.